All right, so this is going to be chapter 8, core balance and reactive training for fall prevention. So we are kind of putting a special emphasis on the idea that like we are using core training, we're using balance training as tools to enhance our clients' life by preventing them from falling, right? Like with a normal person, or not a normal person, but like an average client, you might be, working on the ab stuff because they want to carve out their six pack, right? Like they're like, well, I want to get beach ready, right? And it's like, all right, well, we got to focus on fat loss first. But yes, like let's do some stuff that's gonna, make your abs pop, Um, and then or you might have a client who's like trying to increase their core strength because they need it for stability in like the sport that they're playing, right? Um, or maybe we're doing balance training to help with like athletics or something, right? But with our senior clients, really the goal here is to enhance their core in such a way and enhance their balance in such a way that it's going to improve their life by making it harder for them to fall, and that's really what we're looking for. We're looking a lot at like fall risks and stuff, right? Which is why we have a fall risk assessment and things like that. Um, so introduction day, fall prevention using core training, balance training, reactive training. That's our goal. We want to be able to talk about how that's going to enhance, health, but also just improve like, functionality and even athleticism. So we're going to talk about the rationale behind that, how to safely progress through that, and how to perform, core and balance and reactive exercises, talking about how they are, progressive and stuff. We got to look at the different levels of the OPT model in order to understand this. So if we're looking at the incidence of falls, right? If we're talking about like how often a client falls, we know that it's a pretty common occurrence. Like as we get older, it actually accounts for a lot of emergency room visits every year. It accounts for like a lot of money, and it even accounts for obviously like injury or injury related death in senior clients, right? So we've got some kind of bummer statistics here, right? 1.8 million emergency room visits, 16,000 deaths in 2005. And then one thing to be aware of that is such a shocking statistic when you hear it, but 1 in 4 people will die within 1 calendar year of sustaining like a hip injury due to falling. So you think about like where you hear about like a senior person falling and like fracturing their hip, right? And here's the thing, here's what we know about that. Like it's not because the hip is very painful, although that has got to be just the most painful break ever, because that bone is so big, right? Like your hip bone is massive. So when to break it, like that's got to be a pretty severe fall. But what it does is it keeps you off your feet for so long that you suddenly become sedentary. And we just know that being sedentary ages us rapidly. It just has really, really, really negative health effects. It ruins our cardiovascular system. This is one of the reasons why we just want to keep people up and moving, and with our senior clients, that's our priority. It's just keep them up and moving. That's our main goal. Without that, we see a lot of health problems escalate very, 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 very rapidly. So this is again kind of one of those things where sometimes I think people focus they focus their energies in terms of like exercise or really anything, like they're just their efforts towards the kind of things that solve their problems, or like are like the cure to things, right? It's like, oh well, exercise is the cure to that, right? And it's like, that's not necessarily what we're doing here. We're not necessarily curing, an older adult of aging, but what we are doing is we are improving quality of life, right? We're improving, like we're having a sort of a global improvement here. When you improve your balance and your core, and you are able to walk in a normal manner later on in life, that's a higher quality of life, right? Like that's what we're looking for there. So we do want to make sure that we're keeping our clients upright as much as we can. So there's obviously like a lot of different risk factors that are associated with the idea of like, increased risk of falling. It could be, we see both like intrinsic and extrinsic factors. Like obviously it could be, you know, the intrinsic things in your life, like you're just aging, and so muscles are changing, nervous system is changing, things like that. But there are also like extrinsic factors as well. Weirdly enough, we do know that you're actually a little bit more at risk for getting injured when you are not at work. Obviously that's, I guess, not true for anybody who's working like manual labor and stuff, but generally we actually do see that as a factor. And so, what we're going to kind of want to continually monitor is how at risk is our client of, falling, right? And so this is where the tug test, the timed up and go assessment, really comes in, right? That idea of like getting up out of a chair, walking around a cone, and then sitting back down, right? So this is a very excellent test that helps us identify whether or not our client is at risk. Like if their time starts going up because they're moving slower throughout that, right? Like if a change of direction becomes a problem, or getting up out of a chair, or getting back into the chair, if both of those things become problems, it's going to slow your client down. And moving slowly is an indicator that like clearly they tried to use their core, but it was like struggling, and so it was a little bit slow, right? Or maybe they tried to balance, but they were a little off balance, so they were a little slow moving, right? Remember, the way we're going to do this assessment, the sort of protocols for it, your client is going to sit in a chair. There's going to be a cone about 3 meters away. They're going to get up out of that chair, walk around the cone, and then sit back down. You are simply going to time your client, and you're going to track it. So maybe it takes like 6 seconds the first week, and then we get that's actually pretty quick. So it takes 10 seconds the first week, and then that drops down to like 9 seconds, and a couple months later, and then a couple months after that, we're down to like 8 seconds. It's like, okay, great, like we are improving our agility, right? Just like it's honestly just like the any drill you've ever done for tryouts for like a sport, or if you've ever watched the NFL Combine, it's like who can get through this task first, right? You're going to go through the speed ladder, you're going to hit that cone, and you're going to time it, right? We're going to see who can kind of go through that kind of stuff. That's a great way to like look for improvement, right? So this is sort of the performance assessment side of what we look for in our seniors, right? So what's great, the good news, right, is that NASM's OPT model is the perfect way to kind of address this, right? Like the OPT model is going to work really well for addressing our core stuff, right? We've got 3 levels, right? And we've got 5 phases within there. And so we've got different types of core exercises. So the question you got to ask yourself is like, okay, well, what type of core exercises am I going to focus on? Am I doing am I trying to, carve out the abs, right? Am I trying to like, make bigger, blockier ab muscles? Well, if that's the case, then, maybe you're going to focus on like a lot of stuff that puts a lot of like concentric and eccentric, movement on those abs. Or are you trying to like teach your spine how to hold itself in place? Like, are you just trying to like, maintain your core stability? Those are 2 very different goals, right? So do you give your clients crunches, or do you give your clients planks, or do you have your client do like a medicine ball rotation throw? Obviously, all of those exercises are very different from each other. They do slightly different things. So we've got different levels of core training here that we are going to talk about, right? I need to make this a little bit bigger. Why am I? Where's the dots? There. We'll go like that. All right. So let's talk about the idea of core training first. So we're going to work our way through all of this, right? But let's go ahead and start with core training first. So core training, obviously, I mean, I don't need to tell you guys how important this is, right? Like we know that like the ability to kind of hold your discs in place is super, 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 super important, But what a lot of people don't really realize is that most individuals are actually pretty good at moving their spine around. they are not so good at stabilizing their spine. Like, it makes sense when we say like, hey, stabilizing your spine, holding your spine in place, hugely important, right? And like, it's like, yeah, great. I understand that, right? Like, it's like a Jenga stack. I don't want the Jenga stack to fall over, right? Like, got it. Um, but to understand that like that doesn't come naturally, and that's something that we do have to kind of train for. And the way we train for it is we resist movement. It's less about like, crunching your abs. And I know that like if you do like a million crunches, you're real sore in the abs the next day. Absolutely. Like, guaranteed you're gonna feel that way. But you're not going to necessarily be working on the parts of your core that are stabilizing that spine and holding that spine in place. That is really where, resisting movement comes into play. Learning how to like, as your body tries to move this way, you resist it and keep it straight, right? Think about like what a plank is, right? If we look at like, if we just look at the plank here, this is resisting gravity. Here's like a high plank, right? The idea here is that like gravity is pulling down this way. So she's resisting gravity by strengthening her, tightening her core and keeping herself upright. That's really what we're looking at here. And then we can see like, here's, variations that can make this even more challenging, right? Like she can do a row into a tricep extension. She can do raises, right? All of these things are going to be, effective tools for like, she's focusing on stabilizing her spine in one spot here. So there's a lot of different exercises. There's not just the plank. There are like McGill setups are some of my favorites. Floor bridges are really good. The idea here is that we're learning how to like kind of hold our spine in place. Once we know how to do that, well, then we can start being like, all right, well, great. Now I know how to, now my spine, is stabilizing the way it's supposed to. Now I can start working on how to move my spine, right? Like now I can start looking at, trying to move through a full range of motion. That's where, strength core exercises are really going to come in, right? We build this foundation of learning how to hold the joints in place. And then we kind of capitalize on that foundation that we're building by making things more challenging. And that's where, crunches and sit-ups and hanging leg raises and wood chops and all that, fun sort of strength stuff that you think of when you think of ab work. That's what comes down into the strength level. And then finally, we got like the power level where it's like, okay, well, now I know, I've taught myself how to stabilize my spine. Then I taught myself how to move my spine. Now I can talk about like moving my spine, faster than the next guy. Like I can talk about like moving my spine at fast speeds, and that's where we get into the power level. So what we tend to see is we know that our clients are definitely going to lose efficiency in all of these capacities, again, due to nervous and musculoskeletal changes. If imbalances develop, which they very commonly will, that is often going to happen where the movement system is very, very strong, but the stabilization system is very, very weak. And I know I pull this example up all the time, but if we look at lower cross syndrome, this is exactly what we're talking about, right? I know we've looked at this, we've been looking at this posture pretty consistently for the last couple of weeks. But when we think about like the idea here, like your erector spinae, right? What are the erector spinae in charge of? They are in charge of spinal extension, right? And one thing that's not great about like this chart right here is that it's saying weak abdominals. And that's not actually a very accurate way to describe this. It is weak abdominal muscles, but it should be weak stabilizing abdominal muscles is what we really should be putting emphasis on. Can I get a different version of this chart, please? Actually, we'll go like right here. Yeah, we're not. I do want this, but I want this picture for the next one. All right, well, we'll go ahead and just explain it without, but we can see that it's weak abdominal muscles. It's not necessarily the ab muscles that crunch your abs. It's not your rectus abdominis. Remember, we've got those two separate ab layers, right? We got the outer layer that we see and the inner layer that we don't. The weak part of this is the inner layer, the layer that is going to stabilize the spine and hold it in place, not so much the part of the spine that does spinal flexion. So if we have excessive spinal extension and we're not able to resist that movement, because that's what stabilization is, it's resisting movement, right? Well, then we're going to get a lot of like, a spine that's in not so good shape. And then the exact same thing is true, obviously, on the other side, where we see like the glutes are going to be weak and the psoas are going to be weak, but that's not necessarily, we're going to spend too much time on that part of the core today. Now, the exact opposite could be true as well. You will occasionally, this is a little bit more rare, but sometimes you'll see a posterior pelvic tilt. You'll see this type of rotation, which is also not so great, right? So what's happening here is the hamstring muscles are pulling down in the back, right? But again, we're not going to really, we're not spending too much time on the hamstrings today. But now we're actually seeing the rectus abdominis, those crunching ab muscles, right, which are attached to the very bottom of your pelvis, right, the front of your pelvis here, and it runs straight up superiorly, and grabs all this different, it grabs up here actually. It grabs just under your sternum. So you can see here, if this muscle pulls, like if you've got this like layer of muscles here, actually that's great. If you see this like layer of muscles here, right? If this pulls, you can see like what's happening in this picture is like, we're seeing spinal flexion, right? This person's kind of crunching downwards. That's what this is supposed to do. But if it gets so tight that this section doesn't want to move, what ends up happening is the pelvis instead rotates this way. So then the low butt actually kind of tucks under. That's what a posterior pelvic tilt is, right? And again, this is an overdeveloped movement system and a lack of stabilization. So what we need to strengthen to kind of fix that and rotate this back in the direction it's supposed to, is we need to strengthen all the multifidus muscles and the erector spinae in the back that are going to stabilize the low back and hold it in place, right? So that is sort of like what happens to our clients when they have like an overdeveloped movement system and a weak stabilization system. What we start to see are these predictable patterns of injury. We start to see low back injuries be very common. In anterior pelvic tilting, knee problems are actually really common, right? In posterior tilts, hamstring tears are really, really common. We start to see all of these kind of predictable patterns of injuries that we know sort of happen to everyone who has this postural distortion. So again, there are going to be 3 levels of core training, right? There's going to be stabilization, strength, and power. And you want to think of these as like there are different types of core exercises. So, I think I used this trick question yesterday, but I'll ask it again. Which is better, guys? Which is the best exercise? Is it planks, crunches, or hanging leg raises, or medicine ball overhead tosses? Which exercise is best? You get one answer from somebody. Okay, everybody's real quiet today.
It depends on what you want to do.
What's that?
It depends on what you want.
Yes. Yep. There is no real answer to that, right? There is no best exercise. It depends on what you want to do. Perfect, right? So one is not better than the other. They do different things, if I want to get into a small parking spot, I want a compact car. If I want to haul a trailer across country, I want a big old pickup truck, they're both good. They just do different things. So taking a look at these different levels, right? Let's first look at core stabilization. We're going to start at the bottom here, right? So core stabilization, if you've got a client who is in the stabilization level, how do you spot a core stabilization exercise, right? So we kind of talked about this yesterday. There's a difference between like long, slow, big, long pauses, these big, long holds. That is how we static stretch, right? That's how we're going to hold our stretches and really improve joint range of motion. But we also have stretches where you might move for 1 or 2 seconds at a time, right? Or you might have dynamic stretches where you move through like a full range of motion dynamically. All of them are good. They just do different things, right? So you need to know like the defining characteristics. If you were to see like, you know, an exercise on Instagram or something, and you're like, I want to do that exercise, and you need to figure out like where you're going to do that with your client, like where you're going to work that into their program. It's going to depend on like what your client is working on. If your client's trying to improve joint range of motion, you should focus on static stretches. If your goal is to improve strength, you should focus on active stretches. And if you're focused on, you know, actually increasing your nervous system's activity and getting everything to kind of light up before you start exercising, well, then you're going to do dynamic stretches, right? Same thing with the core here, right? If our goal is to create like a solid core that is injury proof, and really good at like holding itself in place. If we're trying to build our foundation, you know, we want to make sure we know how to stabilize our spine. That's the foundation. From there, we can then, you know, amp up the difficulty and start moving the spine around, right? So once we do that, that is where, okay, great. Once we've got a stable spine, now we can start moving it, right? So we're going to focus on the types of movements that build that foundation, stabilization style movements. So how do you spot a stabilization core exercise? Well, this is where you need to pay close attention to your defining characteristics, right? It is core exercises that involve little to no movement of the spine and pelvis, right? I always like to use this as like, I always like to say this is like the bird watching analogy, right? Like there's a difference between like a blue jay versus a scrub jay. These are two different jaybirds related to each other, but they look slightly different. If you were a bird watcher, you would look for this little like mohawk thing, and that's a blue jay. And if you were, you know, notice like a little more gray in the feathers, that's a scrub jay. Those are the only two things about birds I know. We are at the end of my bird knowledge. But I know that if I were like, you know, trying to like, you know, if I knew that like blue jays made really good pets and scrub jays are jerks, right? Well then like, and I were trying to capture one for like a pet reason. I don't know why I would be doing this. This is a weird scenario. Then I would focus on trying to catch a blue jay. I need to know what they look like, right? Same thing is true with our core exercises. If you're trying to pick the right type of core exercises, you need to know what their defining characteristics are. So core stabilization exercises are the types of core exercises that involve little to no movement of the spine and pelvis, okay? You are going to perform these core exercises for anywhere from 1 to 4 sets at 12 to 20 repetitions. I will say a lot of times, I already said, this is exercises that focus on almost no movement of the spine. A lot of core stabilization exercises tend to be isometrics rather than repetitions. So chances are you'll actually do this for anywhere from like 30 to 45 seconds. Your tempo should be slow if you're moving, right? And when I say moving, I mean very little moving. But chances are, again, it'll be isometric. And you're going to take anywhere from 0 to 90 seconds of rest. So the classic example of this are things like the prone iso abs, right? That's our plank, right? When we think about like what this exercise is, you know, this is an exercise where you do not move your spine. You are stabilizing your spine. You're holding it in sort of one position, right? Or a side plank. That's another really good example, right? The side plank is a really good example of a core stabilization exercise. A bird dog, right? If you're going into this version here, this is a great way. That's actually a bird dog. You know, this is a great way. You're focusing on stabilizing your spine. You're moving your arms, you're moving your hips, right? And that's going to give you this long lever, which is going to make it harder to stabilize the spine. That's great, but you are holding your spine. You're not doing a lot of like movement, rotation, spinal flexion, spinal extension, lateral flexion, lateral flexion. You're not doing any of that, right? You're just simply staying in one position. So one of my favorite versions of this is one thing that I actually, you know what, we're gonna watch a whole video. How long is this? That's not bad. All right, we're gonna watch. This is by Squat University. This is one of my favorite channels on YouTube. And he's going to walk you through these 3 core exercises, which we've already kind of talked. We talked a little bit about the side planks. We talked about the bird dog, right? But he actually is going to show you how to do what's called the McGill sit-up. We've done this in class before, some of you. This is my favorite core stabilization exercise. And in fact, this is my favorite core stabilization routine. I almost do this with every client I've got. I almost start every single client with this because it's a really great way to kind of build your foundation. And it was all formulated by this physical therapist, Dr. Stuart McGill. He's kind of like the core guru. There he is. He's kind of the core guru in the world of weightlifting and stuff. So here's a fun little video.
All right, guys. So today we're going to talk about the 3 core stability exercises you should do every day.
I just realized I need to do the share audio thing. Share sound.
And get down, get up, and get... Now, if you heard that one word in that phrase, it was stability. I'm not going to be talking to you guys about the 3 dynamic core exercises to work your abs. This is a stability video, meaning the emphasis is on limiting excessive or unwanted motion at our spine so that we can have awesome carryover to the exercises that we're looking to perform in the gym, like your squat, your deadlift, your bench, your clean, and snatch. If you do these exercises, I promise you, you will feel much more powerful in each one of those movements. So let's talk about what the exercise grouping is called, the McGill Big 3. Now, these are based off of the research from renowned back expert Dr. Stuart McGill. Now, Dr. McGill has spent his entire life working on how to stabilize the spine and understand how the way in which we use our spine leads to certain types of injuries. Now, whenever we're trying to keep our spine resilient to injury, under load, we want to brace it, lock it into place, and then move about our hips. So the different exercises that we do today, starting off with the curl up, are going to emphasize that. Now, when a lot of people work the front of their core, what do? They do crunches. They move their spine. Look at my spine right now. It is flexing up and back down. Now, while that's not a bad exercise at working the front of your core through movement to strengthen your rectus abdominis or six-pack muscles, I want to emphasize stability. I want to limit any motion at my spine. So what am I going to do? Drop one foot. Now, if you're not in pain, doesn't matter which one. You're going to have your hands underneath your low back. Now, these hands are pressure sensors. They're going to pick up if you round your back. So keep your hands here to feel for whether or not that happens. What you're going to do is brace your core. You're going to turn all those muscles on, and then you're going to pick your head up just slightly off the floor and hold for 10 seconds. The hold is the most important part of this. We're not just moving our spine. We're trying to emphasize stability by getting those muscles to kick on and lock the spine in place. So this is what it's going to look like. Brace, pick the head up slightly, hold for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10, and then back down. Now, if you're feeling your neck is a little turned on and maybe just a little bit stiff while you're doing this, all you're gonna do is tuck your chin first. So just tuck your chin a little bit and then pick up. And that may help a lot as far as taking some tension off the front of your neck. But again, this is a slight pickup of the head. What I don't wanna see is this. Don't pick your head up this high. All you have to do is pick it up slightly. And by holding it here and keeping your core braced, all these muscles on the front side of your spine, like your rectus abdominis, your transverse abdominis, all those muscles are turning on really, really hard to basically stiffen the spine. Now, back down, something like this, do 6 reps in a row, and I promise you, you'll feel...
Really quick, I just want to address one thing. You know, I know there is actually an exercise called the reverse plank. It's this kind of fun one here. This exercise is great. Like, I have nothing against the reverse plank, but if you ask me, this exercise is the true reverse plank. You are literally resisting, you know, falling back, you know, sort of to earth here. You're just bringing yourself up and learning how to kind of hold that and stabilize that. Do this, if you are doing barbell squats, do this beforehand. I actually, this is kind of a weird personal thing. So my neighbor across the street from me has, he's like a big CrossFit guy, and he was having pelvic floor pain. He was actually having trouble, like he was like having, you know, pain whenever he was squatting. It felt like someone basically had punched him in the lower gut. And I was like, oh, well, you do a lot of like movement, you know, like CrossFit's very like plyometric based and stuff. I was like, chances are you just, you know, something kind of was neglected a little bit and didn't get a chance to kind of keep up. And I sent him this video, and then I sent him like how to, put it in a program. And like, it fixed it with like that. It was really quick. It took him a couple weeks, and he was like, every time I see him now, it's like every time I see my neighbor, he's like, squat's better, and I'm like, great, man. Good to hear it. It's kind of a fun thing. But anyway, this is just a terrific exercise.
Feel those muscles working. Now, what does that exercise do? Like I said, it's working the front of our spine. There is no one size fits all when it comes to hitting all the parts of your spine, because there's a lot of muscles that surround, that make up the core. So we need a different barrage of exercises to really hit all parts. Now the next one, let's do, how do we hit the side? Side plank. Now, you're gonna get down on your side from your elbows. Now the modified version is usually one of the most easy go-to exercises. You're just gonna pick up and hold in this position. Now this is a great exercise for hitting that downside part of your core and your lateral hip, your glute medius. So if you have a very weak or poorly coordinated glute medius, lateral hip muscles, you'll feel this working there too. Again, 10 seconds and then back down. Something like this, 6 reps on each side. Now if this is really easy, how do you modify it? Let's go to a full plank. From here, when you put our hands here, this is step 1. If that's too easy, put your hands here. Again, we're holding for 10 seconds. We're turning on those muscles of the spine. We're limiting excessive unwanted motion. I want that spine here, and I don't want to twist. We're limiting excessive or unwanted motion of the spine and stabilizing and locking it in place.
All right, I hate to do it. I know I'm interrupting again. He touched on a really good point that he's not spending too much time on. You can, when you're doing the side plank, wrap your arm around and grab like your opposite shoulder. Like he was talking about bringing this top hand over here. And then if that's too easy, then you can take your hand to your hip. What that does actually by slightly rotating like that is that actually puts a little bit more pressure back on the front portion of your spine, which tends to be a little stronger than the side portions, Like I know plenty of people who are good at planks, but then they're terrible at side planks. So if, you've got a little bit of imbalance there, you can start and, a slight regret, start on the knees, and then move to, with the full on to the feet, but with your hand wrapped around your shoulder. And then from there, you can make that slightly harder by going hand to the hip. And then you can make it even harder by raising this top leg eventually and putting all the pressure on just your bottom leg alone. And like he said in the video as well, this is a great way to turn your side butt on too. Like if your gluteus medius is underactive, which your client's got knees caving in, here we go. This is a great exercise. So again, that was the last interruption, I think. Here we go.
So again, 6 reps each side, 10 seconds. Now we're gonna go to the last part. We've hit the front, we've hit the sides, let's hit the back. Now, when most people think, how do I work the back? What do? They're trying to work back extensions, Supermans, things like that. You're moving your spine into an overarch, into extension. What do we want to do? We want to limit excessive or unwanted motion of the spine, lock it in place in a neutral position, and stabilize around that. The bird dog is a great exercise for that. Very low load on the spine, but working those muscles, the erectors of your spine very well. This is what you're going to do. Get on all fours. Now again, find that neutral position. So you're not rounded, you're not overarched. Find that middle position from right here. You're going to brace your core, and you're going to go opposites. So we're going to go right hand extension, left leg kick out. We're going to go out, and we're going to hold it for 10 full seconds. Now, after that 10 seconds, keep the spine braced. This is the part where a lot of people mess up on, is we're going to slowly come back, not move your spine, touch, back out. Hold for another 10 seconds. We're sweeping under our body. If you think about this, what's happening at my hips? Flexion, and then back. This is like a squat as far as the motion that's occurring. Back flat, no motion at the hips. I don't want this, because what just happened? I lost my neutral spine in my back. So as you go out, you're holding, you're keeping that core braced. Hold for 10 seconds, sweep back under the body, touch, and then back out. Now, common mistakes that I see with this exercise. First, kick the leg way too high. Now watch my back while this happens. I'll just do the leg movement, but people do this. What happened to my back? It overarched. it extended. I want that foot only a couple inches off the ground. Watch the difference. Over arch, I'm gonna keep it just a couple inches off the ground. Do you see the difference? So we're able to keep that core in a little bit better position because we're keeping our hips moving as they should, because the hips directly affect the spine. Next thing, I want you to think about really making a fist as hard as you can with your arm. And when you do that, you're gonna light up some of those muscles of your upper back as well. If you do the bird dog correctly and create as much tension from fist to foot, this is gonna be tough. You should be sweating by the time you're done with this. So watch how I do that with a lot of emphasis also in my fist, making a lot of tension. So we're here, brace, fist, out. 4, 5, 6, 7, 8, 9, 10. Under, tap, back out. And again, 10 seconds. Now, if that is too tough for you and you're wobbling all over, how do you regress? You can do that with only the hips. So just be here and just extend the leg. Hold that for 10 seconds and back. Or if that's even too tough, you can do it where you're just moving your arms. But again, the end goal is just going all the way out and holding. A way that you can again progress that, if you want to add in just a little bit more dynamic movement of your arms, is going out and you can draw some squares. Again, emphasizing core stability.
I got a little crazy there.
While extremities are moving, that is the end carryover that we're looking for in our core stability work, because it's applicable to the way in which you move in the gym. Stable core, movement of extremities. I have been doing personally the McGill Big 3 before every single workout for the past year, and I've seen crazy carryover into how well and how powerful I'm moving during my workout. On my off days, I still do this. I do a set of 6 for 10 seconds of each exercise. If I don't have a lot of time, if I have time, I do a descending rep scheme pyramid. 6 reps, 4 reps, 2 reps. If you want to do more, 8, 6, 4, 2. But again, the hold is the most important. You must do a 10-second hold to emphasize that stability, to limit the excessive or unwanted motion of the spine moving. We want to keep that spine locked in place while we move the rest of our extremities. But again, the McGill Big 3, I want you to start doing this. I promise you, you will find a huge carryover to how you feel and how you're moving in the gym. Hope you guys liked today's quick video. If you did, please subscribe to my channel, like it, and in the comment section below, let me know if there's anything else you want to learn about in next week's video. Until then, happy squatting.
Big fan. Big fan of this channel, and a big fan of that video in particular. I know I don't want to pick on anybody in particular, but Kenny, I know that we have talked about this before. This is the type of core work that I want you doing like every single day, because you and I have kind of a similar posture. And I know that this has made huge strides for me. It has helped me a lot. So I'm like, come on, you're next, you know? All right, so we were definitely focused on stabilization there. So let's take a look here. We're gonna kind of build out our chart today. You know, if we've got a client who is in the stabilization level, right, we're gonna go ahead and start. We're gonna call this, core. They're going to do core stabilization exercises, right? That's our exercise selection type. And what we mean by that, right, these are core exercises that involve little to no movement of the spine, right? So that's what we are going to sort of define that. That's our defining characteristic, right? That's how we're going to be able to spot core exercises in the wild, right? If it's a stabilization client, that's the type of exercises we are choosing. Now, let's say your client is killing it. You've been working with core stabilization for 30 days now. They're feeling solid. And now it's like, all right, let's make it a little bit more intense right now. Like your spine's stabilizing in place. Your posture is looking better. Like, let's make this more challenging. Let's take a look at some more of the idea of like full on strength stuff. Let's see if we can, put some inches on those, put an extra bacon strip on the front of those abs, make them a little thicker, right? So this is where we get into the idea of like level 2. this is either going to be, this is going to apply to any client who's in phase 2, like strength endurance, any client who is in phase 3, hypertrophy, or any client that's in phase 4. It doesn't matter what phase they are in, they are going to get the core strength program. So again, like, look at how much longer you can spend in the strength level. You know, a lot of times, like sometimes, you know, I see students, they're like, oh, I don't like planks. I just want to do all the crunches and stuff, you know. It's like, you have plenty of time to do that. You only have to do stabilization a couple times a year, you know. We spend most of our time, we're focused on, so we have 3 phases to just 1, you know. But this is where we are going to choose core strength exercises. Now, how do you tell if it's a core strength versus core stabilization? Well, these are core exercises that involve a full concentric and eccentric range of motion of the spine, right? So these are core exercises that do move the spine through its complete range of motion, right? So as we're looking at that, we're thinking of things like cable rotations are a really good example, right? You know, that's a core exercise where you've got a cable and you're actually rotating all the way through like a full range of motion. Or maybe it's like stability ball crunches, right? So this is, by the way, NASM's favorite trick question. It's not actually a trick question, but they love to ask you this question here. They'll say, which of the following phases or which of the following exercises would be most appropriate for a client in the stabilization level? And they will do 4 options. So you're looking for whatever exercise. Let's see if NASM's got one. They're looking for whatever exercise, right, is most appropriate for a client in level 1, right? Stabilization clients, right? And so people will immediately see the stability ball and they'll say like, oh, stability ball crunches are on there. And they'll go, stability ball crunch, that's the right answer. We know that's not the right answer because this is moving the spine. It's not stabilizing the spine. Therefore, this would be inappropriate for a client in level 1. But it's super appropriate for a client in level 2. If our client's in the strength level, yeah, stability ball crunches all day, you know? Or maybe stability ball back extensions, right? You can actually do the exact opposite, right? Okay, internet, come on. Is that Facebook? What am I opening Facebook for? No.
For this move,
all right, it's not an NASM, but here.
when you start, bring your hands behind your head with your elbows out and make sure that you're starting with your back rounded over the ball. Then squeeze your glutes to raise your chest off the ball and hold for 1 to 2 seconds.
A little bit hyperextended, but not bad. So there we go, right? That would be like you know, these are hyperextensions on the stability ball there, right? So both are really good. I like that. So, you know, this is going to strengthen your low back. The cable rotation is going to strengthen your obliques, and stability ball crunch, that's going to strengthen the front of your abs. You're trying to carve out your 6-pack. There you go. You got 3 movements that are perfect for that. Obviously, there are more in your textbook. You know, we love hanging leg raises. We love Russian twists. Long lever crunches is probably like one of my all-time favorite exercises. Just because like it puts so much more pressure on your abs than you would think it would. You know, yeah, actually, here we go. Just by simply taking your arms up overhead, now suddenly there's all this weight pulling back. And so it reduces your mechanical advantage. It adds torque to your spine. So it makes it a lot harder to perform that exercise. Love it. Super fun. And then eventually, you know, a little 5-pound weight in your hands and then a 10-pound weight, and, you know, you're kind of working your way up. So that is, you know, again, core exercises that involve a full concentric, eccentric range of motion. And then this is going to be, you know, 2 to 3 sets for these, 8 to 12 repetitions. So we're getting a little bit, you know, heavier with the weight. So the reps are going to go down just a little bit. Our tempo is going to be a medium tempo. You're going to go 1, 2, 1, 2, sort of that classic medium tempo. And then 0 to 60 seconds of rest here. So if we're kind of building this out, this is going to be where we choose core strength exercises. And what is that? Well, that is, oh God, I thought I would be smart. Okay, it's not gonna work. I'm just gonna type it. Core exercises that involve a full dynamic, concentric, and eccentric range of motion of the spine, right? So we're really gonna move our spine, ooh, hate that, through a full range of motion here, right? That's our core strength exercises. So that is sort of level 2, right? So now, let's say you've been working with your client for, let's say you're on your 3rd month, right? And you're moving them, you took them from stabilization, then we moved them into strength. Now you're going to move them into power, right? Well, here, guess what? You're going to choose core power exercises. I think you guys are probably seeing the pattern by now, right? Like, we're talking about core training. We've got stabilization, strength, and power, core stabilization, core strength, core power, right? So our exercise selection, our core power exercises. And the idea here is that these are core exercises that involve a full concentric eccentric range of motion of the spine. So that sentence is exactly the same as it was here in strength, but now we're adding at functionally applicable speeds, AKA we're going to move fast, right? So this is where we're going to move the spine through a full range of motion quickly in order to develop rate of force production, right? If we were developing force production in strength, now we're developing rate of force production in power, right? And we're doing it for the core because that's what we're talking about, right? So this is going to be pretty similar, but you're going to see 2 to 3 sets, 8 to 12 reps. That's all about the same that we saw last time, but we're going to see an explosive XXX tempo here. Every repetition should be explosive and really, really, really fast. So if we look at like the classic, my favorite example is the medicine ball pullover throw. And it is crunches like this. It actually does take me a second to find a demo that I like. This guy's going to be, well, it's not bad. Okay, he's close. He's almost, actually, yeah, he's getting a little bit of a rhythm. He's so far away from the wall that this is clearly a little challenging. There, that was perfect. Okay, so what we see in this, right, is that he's doing a crunch very explosively, right? So he's crunching up explosively. So that's obviously concentric power, but we also need eccentric power. So what I want to see is I want him to catch this ball, have no pause, and let that momentum of that ball kind of carry him backwards and then rebound as fast as he can back the other way. So it looks like this. Like he kind of gets into it, like, he's having a little bit of targeting problems, but that one's perfect, right? Like whenever it lands nice and high, it puts him right where he needs to go. And he's able to kind of get back and then immediately sort of rebound. And that's really what we're looking for. We're looking for like a rebounding effect on these explosive movements. So medicine ball pullover throws, medicine ball rotation chest pass, that's a really good one. Medicine ball wood chop throw, all of those are really, explosive, really great core power exercises. Is this the one I want? Yeah, so see, his angle is a little bit different. I would much rather have him like lateral to the wall and rotating the other way. But like you can see, instead of like rotating from front to side, he's going from side to front. It's still a legitimate way to do this. But see how like he's not pausing in between reps. Like the ball comes back and he goes right into his next one. He's almost got a little pause in there. I would definitely take that pause out because we want fast concentric and we want fast eccentric. Yeah, see, this is terrible, right? Like this is super what you don't want to do. Just throw, catch, reset. That's only explosive in one direction. She's only concentrically being explosive. She's not being eccentrically explosive. So a lot of different versions out there, but we definitely want to go explosive. It's not, eccentric for 1, isometric for 1x. It's not 1x, it's xxx, right? It's explosive in all 3 directions. So if we look at our little chart that we're building here, right? we're going to have core power exercises. And these are going to be core exercises that move through a full range of motion at functionally applicable speeds, which is the fancy way of saying, you know, the exercises that move fast. And we'll put this right about there. So, so there we go. Now we can see we've got our core power, we got our core strength, we got our core stabilization exercises. And that is sort of our guide to sort of overall like core training, right? Okay. Any questions on any of that, guys? Any questions on core stuff before we move into balance? Everybody feeling good?
Yeah.
Cool. Oh, actually, I forgot. Core safety guidelines. Sorry, one last thing. Watch for dizziness when your client is getting, a lot of core exercises are on the floor. A lot of our senior clients have blood pressure problems, and really just a lot of clients can have blood pressure problems. If that is the case, make sure you are watching to see if your client gets dizzy from standing up too quickly. If they have high blood pressure problems, for instance, they're probably definitely going to get dizzy, which is why you actually really shouldn't be doing too much head movement. Observe for muscle cramps. That can happen as we get older as well. And then make sure that your client is breathing deliberately. People have a really bad habit of holding their breath on things like planks. Don't do that. All right, so balance training. Balance, by definition, is going to be how far outside your base of support you can maintain equilibrium, right? Like how far can you move outside your base of support without falling, right? You know, when we talked about like, I think we were talking about this in the last course. If we look at the STAR excursion assessment, right? This is that assessment where you stand in the center and you reach as far away as you can, and you know, generally use like a little mat to kind of mark how far away you are reaching, which is where you'll see they'll sell these STAR excursion mats. I mean, this one works, I guess. And you reach out and then you mark, this guy's sitting for some reason, but you're going to reach out with, you know, standing on one foot, you're going to reach out, and however far you reach, you know, you're going to mark how many inches that is. And the further you can reach out, the better your balance is. So we can measure improvements in balance, right? Like see this person here, you can see this section on both sides is where they are struggling the most, right? Like they have a really hard time going in that that lateral upward direction, right? And you can see like they're a little bit stronger on their left than they are on their right. So it's kind of interesting. You can track this objectively and look for improvements. So that is that's what we're talking about when we talk about balance, right? And remember, balance, a lot of people think it's a very static process. Like a lot of people think that, like, you know, you're just holding yourself in place, and so it's very static. Balance is a very dynamic process. It involves a lot of little tiny, like little micro movements that you're not really realizing. Think about like last time you stood on one foot, right? Your foot does all that like weird gripping stuff, you know, like your big toe grabs, and then like, you know, you roll your foot, you're kind of, you know, balancing consistently. So this requires very optimal balance dynamics, and it's a really great way to improve your neuromuscular efficiency. Remember, neuromuscular efficiency, one of the most important concepts in our field. It's the ability to recruit the right muscle at the right time for the right amount of force, right? We're trying to teach the brain and the nervous system how to control our muscular system to move the way it is supposed to move, right? We want to recruit the right muscle at the right time. You recruit the right muscle, but too late, you're going to keep losing your balance, right? Or too early, you're going to lose your balance. If you recruit the wrong muscle, but at the right time, you're going to lose your balance, right? This is a great way to enhance your proprioception. You know, this has been shown to actually improve even things like mobility. It can prevent your risk for falls and injuries. And so we want to know how to progress our clients through an effective like balance routine you're going to do this by starting your client on the floor. And if they get really good at that, well, then we can actually make it harder by throwing them up onto like a balance beam, right? So you guys do want to have this progression memorized. I know I bring this up every time, but like make sure you get this progression memorized in this order: floor, balance beam, half foam roller, AirX pad, Dynadisc. Now you might be saying like, well, what about Bosu ball? Yeah, Bosu's great, but they are copyridden, so they're not in here. You're not going to be asked about them. I would put Bosu balls at the very end, by the way. I think that they are harder than a Dynadisc. But you start your client. Once they're able to kind of master a balance exercise on the floor, you can put them on, a balance beam. We're going to do one of these balance beams, by the way, the ones that are on the ground. And honestly, you probably not even do that one. You will probably do, I can never find an actual picture. Yeah, I guess something like this. Yeah, it's literally just like a 2x4. 2x4 is perfect. You can build your own for, $10. Well, sort of $10. Price of lumber is crazy right now. Then we got half foam rollers. Half foam rollers, that's the next progression. So once your client masters the balance beam, then we can make it harder by putting them on a half foam roller. This can you can use it on the dome top here, which will just simply limit their surface area. So that makes the exercise harder, or you can make it even harder by actually putting your client on the rounded side, right? You can see here, and that's going to move side to side like that. It's a great way to improve that balance. Then we are going to look at the AirX pad. After that, I told you guys this is one of the best investments you can make, is buying one of these little $20 pads. This little squishy pad means that your client can kind of move side to side and front to back, right? They get a little squish. And so it makes their squats harder. It makes balancing harder, things like that. And then lastly, you've got the really advanced one, which is the Dynadisc. And this is the one that's freaking tough. It's this little wobbly disc that can really move through all three planes of motion. It can move front to back, it can move side to side, and it can rotate. So with that, this is just a great way to really improve your overall balance and stuff. So get that progression memorized: floor, balance beam, half foam roller, AirX pad, Dynadisc. And then you're going to work your way through the OPT model. You're going to start in stabilization, work your client up to strength, and work them into power. So how do we spot a balance stabilization exercise? If our client's in stabilization, if they're in level 1 or phase 1, they are going to get balance. When we are picking balance exercises, we are going to pick balance stabilization exercise, right? That's the toolbox we sort of have access to. So these exercises are going to be balance exercises that involve little to no movement of the balance leg. I'm sure you guys are seeing a pattern by now, right? Stabilization is all about little to no movement. It's about learning how to stabilize, how to hold your body in correct positions, right? So balance stabilization exercises involve little to no movement of the balance leg. That's going to be 1 to 3 sets, 12 to 20 repetitions at a slow tempo for 0 to 90 seconds of rest. So if we think about like the perfect example, the single leg balance is sort of your classic, your sort of classic balance exercise. And it's literally as simple as, all right, stand up on one leg, there it is. That's the whole exercise, right? There it is, single leg balance, lifting that leg one off the ground. You're just gonna hold that position, right? And then you can make it harder by, again, this person's using a towel, right? There's a lot of ways to make things harder. Not this, by the way. We're moving the hip there. We'll talk about that in just a minute. But that's your classic single leg balance. Now, if you want to, try something else, you could do the single leg balance with reach, which does involve movement. But you'll notice it is not movement of the balanced leg. So remember, we talked about like not moving the spine. You can move other stuff. Like if you think about the bird dog, you're moving your arm, right? But you were not moving your spine. In balance exercises, we can move something, but we don't want to move the balance leg. So her balance leg is her left here, and then she's going to move her right. She's going to go into the sagittal plane, the frontal plane, and then she's going to do a little transverse swing there, right? So frontal or sagittal, frontal, transverse swing. And that's the single leg balance with reach. And that's probably one of your best balance exercises. And then the single leg lift and chop, which is one of my favorites that I give almost all of my clients. And you can just see how much work this guy's foot is doing. You know, you can really see his foot kind of wobbling there side to side a little bit as he's moving through this complete range of motion, right? Look at all that little micro movement. That's great. So he is moving, but he's moving his shoulders, right? He's not moving his balanced leg. That's the defining characteristic, right? So when we're writing this down, if we're looking at balance training, move that here actually. If we're looking at balance training, actually, I still need my line. We are going to choose balance stabilization exercises for any client who is in the stabilization level. How do you know if it's a balance stabilization exercise? Well, again, just like before, these are balance exercises that involve little to no movement of the balanced leg. Okay, so as long as you keep that balanced leg in one position, you're going to be fine, right? That's exactly what we're looking for here. Next one we've got, if we're talking about the strength level, right? If you got a client in the strength level, well, now we're going to start moving that balanced leg a little bit. Now we're going to get a little bit more dynamic with it. And so in level 2, whether your client is in phase 2 or phase 3 or phase 4, you are going to give them balance strength exercises. And these are going to be balance exercises that involve a full concentric eccentric range of movement of the balanced leg. So if you think about the idea of like a step up to balance, right? That's a great example of like moving your balance leg, right? You know, right here, she is going to step with her right, her left. That is her balanced leg, and it's in hip flexion, knee flexion, and ankle dorsiflexion. So she's moved all 3 joints here, and now she's going to move them through a full range of motion while she doesn't let this leg step, right? And that is the balance portion. And so she's going to go just like this. That's a full range of motion of the balanced leg. That's exactly what we're looking for, right? That's exactly what we want to see. Or if we were to look at like a single leg Romanian deadlift, right? We're moving the hip. There's a little bit of a knee bend there, right? A lot of people get this name confused. A lot of people call this the single leg balance with reach because they're reaching with their hands. No, the single leg balance with reach is a reach with the legs, reach with the foot. But this is a really great way to kind of move through that full range of motion, right? Next one. Next one we've got, if we look at a lunge to balance, right? A lunge to balance is a really great one. This is where you're going to see your client sort of go into a lunge. So she's moving her back leg and then she balances, right? She stabilizes. And you can see, like, look at our foot popped up there, right? That's great. That's dynamic balance. We love that, right? Forward and up, right? So 2 to 3 sets, 8 to 12 repetitions on each leg. You're going to move at a medium tempo, so just a nice, slow, controlled tempo, and 0 to 60 seconds of rest there. So again, if our client is in the strength level, we are going with balance strength exercises, right? How do we spot them? Well, these are balance exercises that involve a full range of motion of the balance leg. Full concentric, eccentric range of motion of the balance leg. I kind of shortened that to ROM here so I can make this fit a little better. So that's what we're seeing in our balance strength exercises, right? And lastly, let's say you get a client in the power level, right? You've worked with your client for 2 months now. It's time to really give them the hard routine, right? Now we're going to do that power level, right? We're going to do balance power exercise. This is level 3 or phase 5. And how do you spot a balance power exercise? These are the most fun. Well, they are balance exercises that involve a full range of motion of the balance leg at functionally applicable speeds. The best way to tell this is if it involves rapid eccentric decelerating, right? If you're basically, if you are basically like decelerating into balance and then like holding and stabilizing, that's a really great way to tell if it's a balance power exercise. So if we look at like, let's get to, let's take a look at the hop with stabilization here. This is one that also sometimes confuses people because it has the word stabilization in it, but that's because it's a balance exercise, not because it is a stabilization level exercise. So the single leg hop with stabilization is this. He's going to jump and he's going to stabilize. That's balance power, right? Jump and stabilize. So he's rapidly eccentrically decelerating and holding his balance. That's what we mean when we say balance power, right? You could do a single leg box jump with stabilization. Yeah, you could do this version and jump up onto a box. That's a transverse version. He did not hold his landing. He's not holding his landing long enough. Do 3 to 5 second hold on the landing. Okay, so our acute variables when we look at this, 2 to 3 sets, 8 to 12 reps each. Hold your landing 3 to 5 seconds, and then you're going to take 0 to 60 seconds of rest. So that is our sort of balance power, right? So balance power exercises are what we're going to choose in the power level. And again, that's going to be balance exercises that involve a full range of motion of the balance leg at functionally applicable speeds, right? So again, rapid eccentric deceleration is what we're looking for, okay? We are looking for a really fast lengthening of the muscle that then goes into like a stabilization, right? So as he lands, right, if you think about it, right, he is landing in rapid hip flexion, rapid knee flexion, and rapid ankle dorsiflexion. Then he's going to stabilize. Then he can come out of it if he wants to. He can, you can see he's putting his weight back and jumping back down. You actually don't have to jump back down, by the way. And then that is going to, he's performing ankle plantar flexion. He's performing knee extension. He's doing hip extension, right? But that's the concentric part. So that's what we're looking for, right? When he goes with gravity, it's really, really fast. And then, oh God, no pauses. And then it goes, really, he's going kind of really slow with the holds there, or at least he should be, right? So that is our guide to balance training, right? So if we'll put that up here. So that is balance training. Okay, so now we've got, a good chunk of what we're looking for in terms of like an overall OPT model, right? We've almost got our whole movement prep, but now we've got to look at the last piece of the puzzle here, which is going to be our reactive training, right? So with reactive training, think of reactive training as, honestly, this is why I like the term. And Bay, you're the only one who hasn't heard this yet. So they're going to call this plyometrics, or they are going to call this reactive exercises. I don't know which version they're going to call for you. You can use them both totally interchangeably. They mean exactly the same thing. Plyometric is reactive. Reactive is plyometric, right? So a lot of people like the term plyo because plyo means explosive. So that's a really popular term. I personally like the term reactive because if you think about like let's just go back to like let's say this is the single leg. This is another really good power exercise. This is the single leg jump down with stabilization. There we go. That's exactly what we're looking for. So he's going to jump down and he's going to stabilize. It's a balanced power exercise, right? So this is actually pretty reactive in nature because what's happening is like as he's getting down to the ground, right? The second his foot makes any contact with the ground, your nervous system's like, ah, we just touched down, right? And then it recruits all the muscles and it reacts as fast as possible. So when we think about like reactive training, you know, it's very explosive stuff, right? It's explosive, you know, plyometric exercises. So you can see here, actually, that's great. Where'd that go? So here's like a plyometric. Yeah, there's a plyometric. Go back to that chest. I want to see that push up again. Where'd it go? You had it in the preview. What? What? What am I crazy? Am I just seeing things? All right, well, we'll go like this. Look at that. That's perfect, right? That's a very explosive, you know, upper body training. You could do explosive, you know, that is talking about like explosive power, but those are just plain plyometrics. Those are just plain explosive exercises. When we say, the reason I like the term reactive training better is because I don't actually care sometimes, depending on like what part of it I'm working on, I don't really care how high you're actually jumping. Now, if I'm trying to make you more explosive, I absolutely care, right? If it's a leg exercise, I want you putting max effort in on that jump every single time. But if I'm trying to train your reactivity to things, I actually care more about your landing than I care about your jumping. And that's what we mean when we say like react. This is why this is in the movement prep section, right? This is your working on your ankle stability to help you land when maybe you miss a step or step off a curb or a taxi, you know, tries to plow you over and you got to jump, you know, like we want to know how to land properly. So reactive training is going to help us prevent falls. It's a very functional activity, and it's very good for helping us prevent falls. It may not necessarily like, you know, I'm not trying to take a senior client and you know, teach them how to dunk, you know, for the first time in their life. I'm not trying to improve their vert. That's not the goal here. The goal here is to get them to, if they do end up in a situation where they're moving very explosively, be able to land without hurting themselves, right? So we have a systematic progression here. We have a progression just like we normally would. If our client, and again, this should only be done if it's appropriate for your client, obviously. If they can't move properly, you shouldn't be doing any of these exercises, right? But let's say you're doing reactive exercises and your client's in the stabilization level. Well, then you are going to choose plyometric stabilization exercises, or we'll call them reactive stabilization exercises, right? And these are exercises. These are reactive exercises that involve little to no movement. I know, shocker of the year, upon landing, right? So stabilization, we see that word, little to no movement again, right? Upon landing. Our reps are going to be pretty low here because we don't need to overtax them. We're not trying, again, we're not trying to improve their ability to jump higher. We're just trying to teach them how to, you know, perform like a good dynamic controlled landing. 1 to 3 sets, only 5 to 8 repetitions, but the important part is to hold your landing for 3 to 5 seconds. So in the same way that like in balance power, we are working on balance, and in order to work on balance, you need to hold your position. We were holding that landing for 3 to 5 seconds. We're seeing the same thing in stabilization. We are holding our landing for 3 to 5 seconds. The difference here is that because it was a balance exercise in the power level, it was on one leg. Since it's a reactive exercise in the stabilization level, it's on 2 legs. We're not trying to improve balance. We're trying to improve landing mechanics. So you will have done reactive stabilization far before you'll ever get to before you ever get to balance power. So So these are like, yeah, 1 to 3 sets. A box jump to stabilization, classic example, right? If your client does box jump to stabilization, they're going to jump up and they're going to hold their landing. Stabilizing, right? Oh, she is not holding her landing at all. Nassim, this is your video. Hold your landing 3 to 5 seconds. Good Lord. That is a terrible demo. She should be holding her landing for 3 to 5 seconds. We're on Nassim's YouTube page. Then we're also going to have squat jump to stabilization. Let's see if this works. Please hold it. Yeah, there we go. So she holds her landing for 3 to 5 seconds. 1, 2, 3. Right? That's a squat. That's a stabilization level explosive exercise. If you are going to do plyometrics with a senior client, this is the type that's going to be very, very good for them. And then there's also, you know, the box jump down, just like we saw in the video we watched before. He was doing a single leg box jump down with stabilization, but you could always do a, you know, if it's a stabilization exercise where you're working on the reactivity, right? I can't think of any better way to work on, you know, landing mechanics than jumping down from a box and then stabilizing, right? But he is doing this with 2 legs. You want to make sure you do this with 2 legs because, again, it's not a balance exercise. It's a reactive exercise. So he's going to step off and he's going to hold that landing. So we're looking at this, right? Let's say we've got a client in the stabilization level. So we are going to do React. I'm gonna say plyometric stabilization exercises, right? So we've got our 3 pieces to our movement prep here, right? We've got plyo. What the hell? Did you change the font on me? Plyometric stabilization exercises. That is so annoying. And then those are going to be the types of exercises that are reactive exercises that involve little to no movement upon landing. Okay, so we're looking at little to no movement once we have our landing there, right? We are stabilizing the landing. So again, core exercises that involve little to no movement of the spine, balance exercises that involve little to no movement of the spine, reactive exercises that involve little to no movement upon, I said of the spine twice. Little to no movement of the spine, little to no movement of the balance leg, little to no movement upon landing. Those are really our big defining characteristics here, right? Now, if your client, let's say you've been working with them for 30 days and now you are moving them into the strength level, whether it's phase 2, 3, or 4, we are going to choose plyometric strength exercises, right? Because they're in the strength level. So these are reactive exercises that involve a full concentric eccentric range of motion, and this is going to be performed at a repetitive tempo. So now we're starting to apply stretch shortening cycles, right? This is where you're actually going to do like a repeating tempo. You do not want to hold your landing. You're basically going to get going and you're not going to slow down, right? So repeat squat jumps here, right? Up and up and up, right? That is now teaching you how to transfer from eccentrically lengthening to concentrically shortening, and eccentrically lengthening and concentric shortening. You're kind of transferring yourself between both of those movements very, very, very quickly, right? You're not taking any pauses there. So a repeat squat jump's a really good example. Let's see here. Repeat tuck jumps are a good one. We can look at that. These are tough. She's driving her legs up, right? She's not taking any, I mean, it looks like she's taking a little bit of, but you're not taking any pause at the bottom, right? That's really the main goal here. Or lateral resqueeze, you know, you could go side to side. So any version of that's going to be really good. We're going to do 2 to 3 sets. We're raising it from, we were going 5 to 8 reps last time. We're going to take it up to 8 to 10 reps this time. We're going to perform that at a repeating tempo rather than holding our landings 3 to 5 seconds. And we're going to do 0 to 60 seconds of rest. So that is going to look like this. We're going to do plyometric strength exercises. And these are going to be reactive exercises that move through a full range of motion at a repeating tempo. So now you really are kind of working on that sort of stretch shortening cycle, right? You're lengthening and then which is a stretch, and then you're concentrically shortening in the exact opposite direction. Finally, we've got reactive power, which honestly you're probably not going to do with most senior clients. But reactive power exercises are going to be plyometrics that are performed at maximum rate of force production. So these are plyometric power exercises. Reactive exercises utilize a full rate of force production and full concentric eccentric range of motion. So this is full range of motion and super, super, super explosive. So when you look at like ice skaters, right? Please be fast. The ice skater with stabilization, not what we're looking for. So it's going to be something a little bit more like this, right? The faster she does her left, the faster she can do her right. Bounding is a really good example. That's not bounding, but this actually is a good example of a reactive power exercise. This is just this is just repeat, like jumping. She's just sort of doing like a high knee skip. That's not bounding. Bounding. Oh, I remember this video. This guy flies. Right? Is it this one? Yeah. Good Lord. So that's a single leg bounding. God, that guy is killing it. So you can see this is a single leg bounding, which is great. Generally, I don't start my clients on this version. But see how he's like, the faster he does one, you know, he has to rapidly get into the next one. That's why this is reactive and it's in the power level. So it's already explosive, but it's also explosive through like both ranges of motion. There's the normal bounding. That's like double, you know. Wait, is he doing like 2 on the left and then 2 on the left, 2 on the right? That's interesting. Yeah, he's doing, that's interesting. Right, right, left, left, right. Right, that's pretty cool. And then there's just kind of, let's just see the classic bounding. Oh God, bounding uphill. I don't know if I got all the way through this video last time. 1, 2, yeah, he's going up. So this is super great for leg power. If you are working on your explosive ability, it really doesn't take a lot of time, but there's a great way to turn your legs on before like a super explosive workout, right? Again, think of your movement prep. It's not a warm up, but it is a movement prep, right? It's the post warm up, pre-workout section, right? So very explosive stuff. Power step ups are another really good one. You can see this is something that should be very, very, very explosive, right? So they're going to step, and the faster you do your left, the faster you can do your right. Okay, that's what makes this explosive power. So there's sort of a difference here, right? There's the repeating tempo, which is just kind of getting into a rhythm. But then there's the power tempo, which is like, it should be like the faster you do one, the faster you can do the other. And that's really important. So with our plyometric power exercises, right? So clients in the power level, they're going to do plyometric power exercises. And those are going to be reactive exercises that move through a full range of motion as fast as possible. Okay. This is as fast as it gets. This is as explosive as it gets, okay? And so that is sort of our guide to reactive training. Okay, so now we kind of got this little chart here, and you can see if we were doing movement prep, okay, just a little bit, not like a ton. No, I can't do a custom, really. All right. You can see here's our overall like movement prep, right? Clients in the stabilization level, they're going to get core stabilization, balance stabilization, and plyometric stabilization exercises. Clients in the strength level, they're going to get core strength, balance strength, and plyometric strength. Clients in the power level, core power, balance power, reactive power. So safety guidelines always begin with when you're doing any balance training or reactive training, you should always be starting your client in the sagittal plane front to back, because that's the plane that people are most comfortable moving through. Then you can start adding frontal plane movement, and eventually you can get transverse plane twisting movements, right? So if I were starting, like, let's say it's a reactive stabilization, right? I'd start with like a regular old box jump to stabilization. Right? Then I would do a box jump to stabilization where I jump to the side, right? And then I could eventually get into a twist, right? And that's going to be how we can kind of work our way through progression, right? Take precaution when you're working with senior clients about any exercise that has them stepping backwards. If you're doing like a step up to balance and they have to step backwards, be careful with that. A lot of times people will lose their balance going backwards. So you should always have like balance assistance available. You should always be there, you know, ready to catch your client if they fall. And how do you make this harder? Well, you know, you make it, you know, if it's a reactive exercise, you make them jump higher, right? You make it more explosive. If it's a balance exercise, you make it more unstable. So regressions involve doing the opposite of that. So summarizing everything up, falls obviously a very big concern for everybody. They lead to a serious injury. They're very expensive, right? So very, very common. Core training is going to be your first line of defense. Then if your client can handle it, go into some balance training. And then if they can really handle it, there's nothing wrong with doing reactive training as long as it is appropriate for your client. We shouldn't just say, remember, we're treating, go back to what we talked about, the difference between diagnosis-oriented exercise management and problem-oriented. If it's a problem, then you should be careful, right? But if it's not a problem, do it, you know? Like I said, I had a client named Al, literally in his 70s, and his favorite exercise were burpees. He loved them. I didn't want to do burpees with him at first. He was just like, no, let me try them, and he crushed it. So, all right, last thing we're going to look at, and last thing I know you guys, most of you guys on here, but Bae, this is mostly for you. So one thing you're going to get in your email today. So Bae, as you're looking through your textbook, right? So if you guys open up your textbooks and you flip to the program, you know, any program design chapter, if you go to the core chapter, the balance chapter, the reactive chapter, or if you go into the back of your textbook in the appendix, you will see that there are these big lists of exercises with like a lot of demos on how to do them. So I would use your textbook, but I did write you guys, this is a resource that I'm going to send you. I went through the book and put the page numbers for every single exercise and the names of them, just so that it would be like sort of an index, right? This will make it a little easier for you to find stuff. So it has every core stabilization exercise in your book, every balance stabilization exercise, every plyometric stabilization, total body stabilization, chest exercise, back exercise. We're going to get into those tomorrow. And that's the stabilization checklist. But then there's also the strength checklist. And then there is the power checklist. So these are three different checklists that you can use depending on what client you are. Remember yesterday we said it's like having different toolboxes, right? Well, take a look at Bob's program here. You'll notice that Bob, remember yesterday we built, we sort of talked a little bit about like what it means to warm up. So here's a warm up that we built, right? If he's in the phase one, he's getting, you know, foam rolling and he's getting static stretches, because static stretches are what we do for clients in stabilization. It's corrective flexibility. But then he's also going to get I'm going to choose one core stabilization, one balance stabilization, and one reactive stabilization exercise. So you'll notice what I did was I simply picked the first one from every list. Okay, so if I am on my stabilization checklist here, right? So here's my stabilization checklist. If I scroll down to the core, oh, actually, I didn't pick the first one. All right, well, we're gonna swap it out right now. Let's say I wanted to do marching, right? Marching is a really great core stabilization exercise. It looks like this, basically. You're gonna hold yourself in one position. This is sort of like the lower body version of the McGill sit-up. I love marching. Really, really good for you. She's stabilizing her spine, and she's not moving her spine through any range of motion, but she's moving her hips, and that's putting the lever, that's putting pressure on that. This is, like I said, it's like the McGill sit-up is like the upper portion. Marching would be like the lower portion. So, you know, if we put that on Bob's program, we would say, all right, he's gonna do marching for 3 sets of 30 seconds, and he'll just hold rep for 2 to 3 seconds, right? And there we go. He's going to go 30 seconds on, and he's going to do as many reps as he can, holding each rep for about 2 to 3 seconds. That's our core stabilization exercise, right? Then we gave him a balance stabilization exercise. We went with single leg balance with reach. So if I were on this checklist, I would just scroll down, and there's the single leg balance with reach, balance stabilization, right? And there's Bob's program, right? And I punch in the repetitions, 3 sets, 6 reps, slow tempo, and we're having him do the frontal and transverse. Coaching tip, I had him skip the sagittal section because I don't like the sagittal part of that movement. And then for his reactive exercise, we went with the transverse squat jump to stabilization. That's a pretty complicated one, but that's the squat jump to stabilization where you do the hold once you're done twisting. So she's going to twist, hold the landing 3 to 5 seconds, twist, hold the landing 3 to 5 seconds, right? So that's transverse plane movement. And again, she's going to do 3 each. So that means she's going to do a total of, actually, that's 9 reps. That's too many reps. It should be 5 to 8 reps. We should make that 2 each. So that is our transverse plane there, right? Oh, wait, no. Sorry, it only goes left to right. That's 3 each. Yeah, that works. That's 6 reps total. Blech, dumb brain. So there's our movement prep. Now, obviously, this is only movement prep. We're going to put resistance training in tomorrow. But let's say we move our client forward 30 days, right? Bob's in his 2nd month of training. We moved from, he started January 1st. Now it's February 1st. He gets a new routine, right? New routine. We are going to give him a little bit of core, a little bit of balance, a little bit of reactive. You'll notice we went to active stretches, right? He's still doing foam rolling, but he does active isolated stretches instead of static stretches. They're the same stretches, right? It's still a wall calf stretch. It's still a kneeling hip flexor stretch. It's just instead of holding it for 30 seconds, he's going to hold it for 1 to 2 seconds, and he's going to do maybe 8 reps each. Then instead of doing the prone iso abs, we want him moving his spine. So we moved from the stabilization checklist, right? We moved from here. We're going to close that toolbox, and we're going to open up our strength toolbox. And that's how we're going to build our program for Bob, right? So we've got ball crunches, back extensions, reverse crunches, cable rotations, anything that involves like a lot of movement of the spine. So now we went with the stability ball crunch, right? Then we went with the single leg Romanian deadlift as well, right? That's that, balance exercise that moves you through a range of motion. Right now we've got him moving his hips, knees, and ankle. So that's a balance strength exercise instead of balance stabilization. 10 reps each, right? And then we got repeat transverse squat jumps, which are exactly the same as our last transverse squat jumps, except now we're not holding our landing anymore, right? Boom, next one, boom, next one, boom, next one, right? Moving from space to space to space to space quickly. And that's what we're looking for there. Now let's say Bob is in his super advanced program. We've got him in the power level, right? Now we're not going to do static or active stretches. We're going to do dynamic stretches. Put him through a little circuit, right? Heel walks, butt kickers, hen pecks, spinal rotations, right? Walking lunge with a twist. 10 repetitions each, and we'll have him do 2 circuits. And now he's nice and warm, and we're going to get into the really explosive core balance and reactive stuff, right? We're going to get into the power level. So I'm going to close my strength toolbox here and open up my power toolbox, which is a real thing that in real life, power tools. Now we're going to look at the medicine ball pullover throw, right? So the medicine ball pullover throw. That is going to be a great, I don't think NASA has a demo for this video. Yeah. That's going to be the one where we see the guy, you know, explosively throwing it. I want him to be explosive, you know, really getting that core work in there, right? Or maybe I move into the single leg RDL jump to stabilization. That's a long name for an exercise, right? But our balance power is going to look like this, right? He's going to be explosive with his balance leg. He's going to go into the balance, and then he's going to jump, stabilize, and go back into that balance, right? So that's a balance. He's in the power level, but he is doing like he's still focusing on balance training, right? And then we've got sort of proprioceptive plyometrics, which is a really long name. But what that is actually, this is where we are going to be explosive reactively, right? We could have done bounding, we could have done you know, power step ups, but this is a really good one, right? You can set your client up with like a little box here, and basically you're going to have them jump as fast as they can, back and forth, side to side, maybe transverse, right? So that explosiveness, he's not taking any pauses. The faster he does one repetition, the faster he can do his next one. That's proprioceptive plyometrics, which are going to be right here on page 285. So we've got ice skaters, single leg power. There's a lot of options out there. And so that's our power sort of toolbox, right? And there we go. We just built 3 months of workouts for Bob. Now he has got, you know, we've progressed him. Now he's much more explosive than he used to be. He's probably added some muscle. He's a lot stronger through 3 months of training. So what we could do, we can go right back into the stabilization phase. We could start over, right? Stabilization into strength, into power. 1, 2, 3, 1, 2, 3, 1, 2, 3. You could very easily cycle through that over the course of a year. No problem. That would be perfect. So that is sort of our guide, right? We kind of worked it a couple different ways today. We worked it sort of vertically and horizontally. You can see here, you know, when you think about this stuff, you want to work your way. If your client's in stabilization, you kind of work your way just across this whole section here, right? If they're in strength, you're going to work this section here. And if they're in power, you're going to work through this section here. And yeah, that's about, oh, I almost didn't say this. I need to use this tonight in the evening class without having to type it all out again. So any questions on that today, guys? Bay, how are you feeling? You're the newest to all this stuff. Checking in with you.
I'm okay. I'm just kind of sinking in all this information, but I just have to review and.
For sure. So I will say, like, this is the stuff, you know, like the sciencey stuff that we teach here obviously can be pretty dense, you know, but this program design stuff, it's so many numbers and it's so many moving pieces that sometimes it feels a little overwhelming. But if I can get an assist from everybody else on this call right now, everybody will tell you we do exactly this lecture 4 times before you leave. We do it in every program design class because we need to learn how to kind of work our way across that chart. So we're definitely going to feel very confident. Like Andres, Isaiah, and Kenny, this is all your guys' second time seeing this, right? No, third time seeing this.
Say that again?
This is your guys' third time seeing it. You're in your third mod, right? You guys started, the first program design class was weight loss, right? And then you did senior, and then you did youths.
I think so. January 4th, right?
Yeah. Yep. Yeah. Okay. Sorry, that's just me. It's harder to keep track of the rotation than you think. So it's you guys, then Jarek. It's Charlie, then you guys, then Jerica, and then it's you, Bay. So yeah. So we'll definitely. So if this does feel kind of like a lot, it's all learning how to kind of follow the patterns, work your way across, and then plug those numbers in where they belong, which involves like looking at charts and stuff. So,
Sounds good.
yeah. All right, guys. Well, cool. Anybody have any questions today? How y'all feeling?
I'm feeling great.
Love that. All right. Well, lady and gents, I will see you guys bright and early tomorrow. We'll let you all out of here.
Later, Brad.
All right. See you guys.